أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الله لا إله إلا هو الحي القيوم لا تأخذه سنة ولا نوم له ما في السماوات وما في الأرض من ذا الذي يشفع عنده إلا بإذنه يعلم ما بين أيديهم وما خلفهم ولا يحيطون بشيء من علمه إلا بما شاء وسع كرسيه السماوات والأرض ولا يؤوده حفظهما وهو العلي العظيم. Allah, there is no deity except Him, the ever-living, the sustainer of all existence. Neither drowsiness overtakes Him nor sleep. To Him belongs whatever is in the heavens and whatever is on the earth. Who is it that can intercede with Him except by His permission? He knows what is presently before them and what will be after them, and they encompass not a thing of His knowledge except for what He wills. His kursi extends over the heavens and the earth, and their preservation ties Him not, and He is the Most High, the Most Great. Sadaqallahu al-Azim.
Jazakallah khair, Brother Ishaq. If I can now ask Harun Khan, Secretary General of the MCB, to start the meeting just by giving some background as to where we've been over the past week with the current crisis and what is to come, inshallah.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين الصلاة والسلام على رسول الكريم أما بعد السلام عليكم ورحمة الله وبركاته. Brothers and sisters, Jazakumullah khair once again for many of you joining us this Sunday morning. This is our third online meeting briefing which we're providing in terms of the response from the Muslim community to the coronavirus, COVID-19. A lot has happened since last Sunday, since we last briefed you. More notably, very sadly, the number of deaths that are taking place. Most notably, I would say in the media, there have been two prominent medics who have passed away, Dr. Habib Zaidi, who was a GP, and Dr. Adil El-Tayyar was a consultant. Inna lillahi wa inna ilayhi raji'un. And beyond that, also many family members. Some of you may have been impacted yourselves. I know I have my friend, close friend's mother passed away a few days ago as a result of COVID-19. And I think it just is starting to really bring it home for many people that the seriousness of this virus, aside from the fact that we're seeing high-level politicians being impacted, including the royal family, but the fact that it's actually affecting everybody, whatever level of society that you're in. And we are only just at the beginning. As you know, the MCB, alongside other Muslim organizations and institutions, has been calling for suspension of prayers and congregational prayers in the mosques before the government made a formal call. And we were well informed, not only by public health, but also by our own Muslim medical professionals and Islamic scholars. And hence we were taking early notice and trying to encourage everyone to act fast. But alhamdulillah, we are here now, and majority of the UK is in lockdown within their homes. And we hope that from today's briefing, you can take something away which will help you to deal with the situation that we're in now. More so because we're at the very early stage. The peak of the cases and the number of deaths is yet to come, and which will be very challenging as a community and as a whole for our whole society. There are a number of issues that will be emerging that we will need to face. Last week, as many of you know, there was intense debate and discussion about the possibility of cremations taking place. Alhamdulillah, the law won't be enforcing this, and it's really been managed quite well as a whole with political support and community backing to get this changed. But we have bigger challenges ahead in terms of the actual burials and so on. And we will be providing you, inshallah, with a lot more guidance on the process of burial and how this can be managed locally. I know many centers and volunteer groups in different regions are organizing themselves, which is great news, to try and manage this as it emerges. There'll also be economic impacts. Some of us will probably already feel this. Some of us maybe not so much. Again, this is another area that we're looking into, not just for job losses, but institutions, mosques, centers, across all sectors. Everyone will be affected. And then there will be other issues coming socially and mentally as well, with some of which will be touched on today, inshallah, in the discussions. And then towards the end, I'll mention a few forthcoming issues as well, inshallah. So, Jazakumullah khairan again to many of you who have joined us again today. I'll hand back to Asif now to introduce the next speaker.
Jazakallah khair. Jazakallah khair, Brother Harun. So I'm first going to introduce Dr. Sufyan from the British Islamic Medical Association, who'll be talking to us about keeping good self-isolation measures at home. He'll be talking to us for a length of about 15 to 20 minutes. He'll give a small presentation, and then we'll open up to questions and answers. I'm afraid because there are so many on the group, we won't be able to take answers over the microphone. So the way we'll do this functionality throughout the entire session is if you could type your answer into the chat box as you think of it during the presentation or afterwards, and I will note down some of the questions such that when Dr. Sufyan is finished with his presentation and the other speakers are also finished with their presentations, when it's their turn, I will ask the questions on your behalf, if that's okay. If we have time at the end and we haven't run over, then we may have time to take some questions or some comments and reflections over the microphone, if that's okay. So if I could just pass over to Dr. Sufyan.
Might need to unmute Asif, just remind.
I think you're unmuted. I can see you've unmuted, Sufyan.
Yeah, assalamu alaikum. I can't share my screen yet. It says I can't share my screen while you're still sharing yours. So, assalamu alaikum. Thank you for having Bima on this briefing this morning. As Harun mentioned, things have progressed since we last had this meeting, and unfortunately they have progressed in the way that we expected and predicted with regards to deaths increasing, more people getting unwell, and our services starting to become overwhelmed. The message that we really want to be getting across is that everyone's got a role to play. And I'm not going to keep this presentation too long because what we need to do is not particularly complicated. And the message essentially is to stay at home. We've got this message from the Prime Minister as well as the First Minister on the 23rd of March that we are under lockdown measures. We need to stay at home. We are only able to leave if we need to shop for basic necessities, and we need to keep these to a minimum. So only going when absolutely necessary. One form of exercise. We don't want people going crazy in the house, so we can get out, but only if we're staying 2 meters apart from each other, because we want you to get exercise, but we don't want you to share the virus and spread the virus and make the situation that much worse. You can leave if you're needing medical care, going to the pharmacy, or if NHS 111 or your GP has advised you to come to the practice. And you can travel to and from work only if the work can't be done from home, and only if it's an essential kind of profession or business that you are involved in. The most important thing being that we need to stay as 2 meters apart, because like I said, we do not want to be spreading infection. Situation is already bad. We don't want to make it any worse. Everyone's got a role to play. Everyone's got a role to play because everybody is at risk of the infection. The young, the middle-aged, the elderly, those with medical conditions, those with no medical conditions, particularly those over 60, those with long-term medical conditions, the pregnant, and people with a weakened immune system have a higher mortality rate. So those who are the people that are most at risk, but everyone is at risk, and everyone can spread the infection. So everyone's got a role to play. As Muslims and kind of a population with a South Asian background, we're at even higher risk, as we mentioned in the past as well, because of the significantly higher morbidity within our community. So in kind of lay terms, we have a higher percentage of patients with diabetes, heart disease, high blood pressure, and these are associated with people dying if they get COVID-19. We have a significantly elderly population, and alhamdulillah, we stay within our family kind of networks. We have close-knit families. We get together. Unfortunately, this is going to be working against us, because if we're living with the elderly, we can be spreading infection to them. Our social nature is usually very good, but this will be spreading infection. So that's why we need to be staying at home within our families. We need to be isolating ourselves. And really going against what we would normally do in our day-to-day life as South Asian Muslims in the UK. COVID-19 spreads very fast, and that's one of the big problems. It spreads via close contact, so this is the reason why we're saying stay 2 meters away from each other. It can spread even before anybody's got symptoms. On average, people get symptoms 5 to 6 days after they've actually got the infection, so they're going about their normal day, not really listening to the advice of staying 2 meters away, and for 6 days they're happily spreading the infection to people that they're coming into contact with, who then might have medical conditions and possibly could end up in hospital or die from it. So essentially, we need to be, this is how it spreads. That's why we need to make sure that we're not staying within that 2 meter distance. We're staying out with 2 meters from each other. And the other way it spreads is fomite spreads essentially on surfaces, and that's why there's a big drive for hand washing and cleaning surfaces, because the virus sits on surfaces through respiratory droplets, and so we need to be careful about that. This is some guidance in how long the virus can sit on surfaces. It's not absolute. There is still more evidence coming through. This is to give you an idea that if you've touched a surface and you had the virus in your hand, or somebody coughed and the droplets fell on a surface, it can last on a surface from between a couple of hours to 5 days. You touch a surface, the virus could be there for the next 5 days unless cleaned. So a number of people could touch that surface for the next 5 days, and then they'll pass it on to others, spread it to other surfaces, spread it to other people, and that's what we need to avoid. So alhamdulillah, as part of Islam, cleanliness is half of our faith, and if we weren't already practicing it, we should be practicing it even more so now. But this is a kind of part of a poster that we presented, it's about a month ago now, but the advice is still the same in that essentially, and this is even more so the case when you're isolating at home, even if, so even at home, essentially avoiding spread of infection by coughing or sneezing into your elbow or into a tissue and throwing it away, so that the respiratory droplets aren't in the air or on surfaces, not touching your eyes, nose or mouth, and when washing with soap for at least 20 seconds, and other things that we need to be avoiding, particularly when we're at home. This is probably going to be even more a case as with regards to sharing utensils, sharing cups, sharing towels, Normally that would be okay amongst family, there's no problem, but unfortunately at the moment we need to be trying to avoid that, because if anybody in your family has been out within the last 2 weeks, they could actually have the infection, but they don't have any symptoms, so they could be spreading it amongst the family. So avoid sharing things, because you could be spreading the infection. So yeah, essentially it's kind of emphasizing that fact and the kind of guidance that's given in Islam anyway. So again, surfaces in the house, we need to be cleaning. The reason for the soap is because it helps break down the outer layer of the virus. So even though we think it's quite a simple agent, it works very, very well. Alcohol gel, if anybody can actually get hold of them, then we can use that instead to clean our hands. And essentially one of the things that's important is that our houses, where we're staying, are well ventilated. If there's virus in the air, it can stay there for approximately 3 hours or so. If the rooms are ventilated, aired out, then the virus will be settling and going away. So essentially it's very important to keep the house ventilated and aired out, and avoid shaking material that could have the virus on it, that could actually make the virus airborne. What we need to be looking at doing is we need to make sure that we are essentially, we need to be protecting our vulnerable. So if there are people within our household who are elderly or have long-term medical conditions that are high risk, essentially we need to be maintaining the 2 meters even within the house if possible. If you have symptoms, then no matter what age category or medical conditions you are, you have to be staying self-isolated. And essentially, it's not about being nice. You need to basically make sure that nobody's visiting you, and there's strict hygiene and within the house with regards to cleaning surfaces, with regards to coughing, sneezing, with regards to being within 2 meters. If you have to be rude, you have to be rude. There's more important things at the moment, such as saving lives. Are we managing what what we're wanting to achieve? So things have progressed over the last week to 2 weeks, and everyone will have seen the curve on your left. Essentially, they keep talking about flattening the curve. So what they're saying, let's avoid the red and go for the blue curve. So what's happening is that the picture on your right is the current deaths in the UK over the last couple of weeks. And it doesn't take a statistician, mathematician to be able to have a look to see what kind of curve we're following at the moment. Two things I would say is, to me, it's looking at the moment like red, and at the moment it's looking like it's very early days. It's very early days, and we've got people that are young, 21-year-olds that have passed away. We've got elders that have passed away. I think in London, if I'm not mistaken, there was between 11 janazas in one day. I think there might have been more yesterday. I wasn't keeping up to date. We've got mothers, fathers, brothers, sisters that have passed away, and we've got Muslims on the front line who have passed away. So as Arun mentioned, Dr. Habib Zaidi, Mr. Adil Al-Tayyar, and a third as well, Mr. Amjad Al-Hawrani, have passed away in Al-June. May Allah grant them the highest level of paradise, forgive their sins, and give their family sabr at this difficult time. These healthcare professionals, as well as other staff that are maintaining our essential services, are putting their lives at risk, putting their families' lives at risk to provide us these essential services. We've got information from some places saying that there's not enough equipment to protect them, but they're still putting themselves at risk. And so essentially, the least that we can do is follow the advice and stop the spread of the infection. But is our public listening to it? We're still hoarding, we're still queuing outside supermarkets, we're still ordering takeaways. That's another thing I didn't mention, is that anything coming from outside into the house can have the virus on it. So essentially, what we're doing is we're putting our own lives at risk, we're putting other people's at risk, and we're disregarding the people that are trying to help the public with doing what we want and not following the advice. Unfortunately, I think we're at a kind of, I have no idea how else to put the message forward that we need to stay at home, we need to be making sure that we're isolating, we need to be making sure that we're keeping cleanliness and social distancing. Do you really think that you are going to starve to death, or is that pizza really worth it to put others' lives at risk. I'll leave that to for everyone to ponder. And if you do stay at home, then regard it as if you've saved a life. And if you do go out when it wasn't essential and you're not maintaining social distancing, then I would go as far as to say that you have potentially put people's life at risk, and there's a good chance that somebody might pass away because of your actions. So take that into consideration. Jazakallahu khairan.
Jazakallah khair, Dr. Sufyan, for that presentation, really useful. We have a couple of questions, although not particularly, I don't think, related to your presentation, although there's one that's just come through which is relevant. So from Brother Shahzad Hussain, on the point of exercise, many who are in the medical field advise not to go out as the virus is also airborne for at least 3 or 4 hours. Can you advise, as the government is advising advising herd immunity, and the medical field are advising something else, can you clarify, as he lives in a joint household, if his parents are vulnerable, and can you also advise about mental health signposting, which will come to actually with Inspirited Minds, as advised in the media today?
Yeah, so a few questions there. So with regards to exercise, well, first of all, I mean, yes, the virus is in respiratory droplets. It is airborne for up to 3 to 4 hours, and that's why we're emphasising the importance of having ventilated areas, and that's why it's still allowed to go outdoors, because if somebody has coughed, sneezed further away from you, the virus droplets will have settled, and so essentially if you're outdoors, not near anybody, then the respiratory droplets will not be affecting you, so you can go outdoors, because essentially it's a very well ventilated area. So exercise is important as long as you're maintaining social distancing, so that is okay. With regards to, I mean, herd immunity is a different question in that they want healthy people to get infected so that they develop the immunity so that it doesn't spread the infection. It doesn't have anything to do with exercise. It's more with time, people we as a population will develop herd immunity to this strain of virus. Can you clarify? It's so what, with regards to joint households, so essentially everyone's going to have their own specific circumstances. So if we're staying with people who are particularly vulnerable. So we've got categories essentially over 70s, and then there's a list of certain medical conditions. And if you have those medical conditions, then they need to be self-isolating for up to 12 weeks. And yes, what you need to be looking at doing is that at the very least 2 meters distance from them, and trying to minimize the contact with them, making sure that we're keeping very good kind of hygiene measures, particularly cleaning surfaces, and surfaces, anything that they're touching, as well as emphasizing that they need to be washing their hands as well before anything goes near their eyes, nose or mouth. And so yeah, it's those categories we need to be making sure that we're isolating as best as possible, as well as anybody else that's kind of vulnerable.
So just another couple of questions that have come through.
Yeah.
Perhaps you could bat them off fairly quickly. Are face masks useful? Are gloves useful? And also, does using some sort of nasal spray or gargling, does that show any benefit to ward off the virus, or is that a myth? And can you also finally tell us if there's anything there to do with 2 meters not being enough of a distance?
So first two questions, no. Essentially, face masks for the general public, unless you're symptomatic, are not useful and can actually make things worse. So keep it simple. Healthcare people that are working with people with potential symptoms, yes, face masks, and there's different type of face masks that we should be using. But for the general public, no. Gargling, nasal washes, again, no evidence to say that there's any protection from the virus by doing so. And is 2 meters enough with regards to social distancing? Essentially, from it depends on where you are. If you're in a closed environment, you're in a room with one other person and you're 3 meters away from them and they're coughing and sneezing you, and then yes, 2 meters is not enough. But generally, as long as, generally 2 meters is enough. I've not read the article about the 8 meters, so I'm not sure what that is pertaining to, but essentially it might be to do with the environment that the people are in.
So just the final question, I think, which is a useful one, just to clarify around takeaways. The brother in the group is saying that reports online say there's a very low risk of transmission from takeaways, but you're advising to be wary. What's the position here?
So I would be wary of anything that's coming from out with. So that kind of slide that I showed earlier with regards to how long a virus can sit on surfaces. So if you imagine that there is somebody who was in the takeaway while your meal was getting made and was coughed or sneezed, or the person who's actually preparing has actually got the virus themselves, and they're touching that bag or they're touching that box that's got the food within, then that can spread the infection. And the same goes for shopping as well. Essentially, we just need to be careful with the food itself, because it's been heated over 60 degrees. Essentially, the virus shouldn't be on that, but the packaging is the problem. So essentially we do need to be careful about that.
Okay, brilliant. Jazakallah khair, Dr. Sufyan, for the presentation and for answering those questions. I understand that we haven't been able to answer all of the questions yet. If there is time at the end, then I will go back to the questions around burial and testing, and we will have perhaps an update about burial towards the end. As Brother Harun said at the beginning, there is something detailed in terms of guidance around burials coming out very soon. If I can now move on to Sister Khadija from Inspirited Minds to start her presentation. You can share your screen, inshallah, and unmute, if that's okay.
Assalamu alaikum, everyone. I'll just share my screen. Okay, thank you for that introduction. So I'll just wait for that to get loaded. So my name is Khadija and I'm from Inspirited Minds. And I'll just be speaking a little bit today about how to keep our households motivated and healthy mentally as well. I think we can all agree this is a topic we are all struggling with at the moment due to the recent adjustments and all the change going on. So hopefully we'll go through a few things that can help us with that. So for anyone who hasn't heard of Inspirited Minds, we are a Muslim mental health charity and we provide confidential professional support to anyone with a mental health difficulty. And the aims initially when we started was just to raise awareness of mental health, to combat any stigma and to put mental health first more than anything else. And we do provide a lot of services. So there was a question earlier around signposting. So definitely see our website for further details, which I'll give out at the end. But we do provide emotional support and counselling. We have some anonymous question and answers available where you can ask Inspirited Minds something that you're concerned about. We also hold workshops for schools, unis and mosques, as well as various events, campaigns, and there's a lot of information, tools and resources available on our website as well. So for further details, do have a look. So in terms of what we're doing around the coronavirus at the moment, we have seen an increase in the number of people contacting us for support, which of course, as you can imagine, is quite normal for a time like this. A lot of people are reaching out for counselling. So we are increasing our support services and getting more counsellors to join the team. We've also created various articles and resources on these topics that are listed on the slides around anxiety, OCD, etc. And we're also doing webinars and Instagram lives as well. So the details can all be found on the website at the bottom of the slide. So far, we've done some Instagram lives around low mood, around OCD, and we do have one coming up around eating disorders as well. So definitely have a look. And we also have a resource that reflects on how we look after ourselves at times of stress and struggle and setbacks. So already got lots of amazing positive messages of hope and ideas. But we'd also advise other people, take some time down, write down how you look after yourself and send in your message as well. So details about that is also on the slide that you can hopefully see there. So when we look at how to actually manage our mental well-being and keep motivated, the one thing that I can emphasize more than anything else is creating a plan for ourselves on our day-to-day lives. Now, usually with work and in a normal situation, we have that structure, we have that routine for both ourselves, our kids, our family. But when there is something like this, a lot of us don't really know how we should react to it, and we can be at risk of not having a plan made for ourselves. So it's really important that we start doing this to really improve our motivation as well. A very common symptom of low mood when we are going through certain changes like this is that we have a tendency to stop doing things. And when we don't do things, we tend to feel very flat and very low in mood. So it's really about trying to let what we're doing affect how we're feeling. So what I would suggest in terms of this plan, and hopefully you can all try this out for yourselves, is start off by having a list of things you would normally do on a day-to-day basis, but dividing it into these 3 topics I've listed here. So pleasurable things, routine things, and necessary things. At a time of crisis like this, perhaps we all have a tendency to do the things we know we need to do around the home, but then we don't spend much time for ourselves or having that me time, as we're just sort of focused on the issue at hand, or we're focusing on the people around us. So the first thing to suggest is really make a list of these 3 things that you would normally be doing on a day-to-day basis, and add to that list as well. And I'll put up some suggestions on the next slide as well, because we need to know what our options are. At a time like this, what are we doing with our day? For those of us working from home, with the kids home from school, we need to know what is going to happen in that day. Otherwise, we can be at risk of feeling quite negative, getting stuck in that negative thought cycle where we think, well, I don't know what to do, there isn't anything to do, therefore I'd rather sit and not do very much. Now, usually this list will comprise of things we do on a normal day-to-day basis, some of which we may not be able to do at the moment, as they might be outside the home, like the gym or anything like that. But what we want to do with these activities is alter them so they're applicable within the home. So if we usually enjoy going to the gym, well, we think, how can I do a workout at home? Do I need to go on a YouTube video or follow a certain page on social media and do it that way instead? If some of us like taking the kids out to the park and actually we don't want to risk doing that at the moment under the guidelines, then we think, well, my kids enjoy it because they're being active. Therefore, how can I adjust this activity so they're still active at home and we're still spending time together? So we have the same values of the activity, but we're making those adjustments. But of course, having a list isn't enough. What we also want to do is, how am I going to get motivated to actually do this? You might have a busy household, you might be more isolated than others, and it can be difficult in either situation to find that motivation. So at a time like this, we want to think about the details of the activity we're doing. So almost make a diary almost, and think about what day, what time, and how long am I going to do this activity for. If we think first thing in the morning, well, actually at some point I'm going to do some exercise at home. It's not a very specific goal. We don't really know when we're doing it or where the time is. So when it comes down to it, we might keep thinking, you know what, I'll do it later. I'm a bit tired. Maybe I'll do it later on. By having that time set and that day and how long it will be, that can actually increase our motivation as we have that schedule, we have that plan. So what we can do is think, well, actually later on at 3 p.m, after I've sorted the kids out and made lunch, I'm going to spend 15 minutes doing a YouTube workout at home. So we've changed the state of that goal. So we know exactly all these details, and that can help with the motivation. And if we still find ourselves unable to do it, review it. That's what this last part is about. That we want to think, well, what could I have done differently? Did I plan it for too long? Was it the wrong activity to maybe start with, considering I'm a new gym goer and actually 15 minutes was a bit too much? Did the kids get in the way of it? If so, what am I going to do next time to avoid this? Just so we can ensure that our routine can carry on as per our plan. So these are just some ideas. I know it's a little bit blurry. Feel free to take a photo of this slide if you'd like, but just a few ideas of what you can do. Bear in mind, some of these aren't so applicable in the current situation with the isolation guidelines, but exercise and activity is a really key one. We always want to manage this as best as we can, as it does have positive links with our well-being if we do have that exercise, indoors or outdoors. Connecting with others is also very important. Again, depending on how isolated you are, always ensure you keep those connections with other people, whether it's a friend, family member, going on a video chat with them, phone call, text message. do things that are quite soothing, because at a time like this, I think we're all feeling a little bit anxious and we need that time to relax. Or also do some activities that require concentration, because that allows our focus to just change for that 10-15 minutes away from what's going on in the world, from whatever stress we've had during the day. And that can be really helpful for us. And also self-care. Always think about doing things like writing down something you like about yourself, something you're grateful for. And self-care can be something as small as just doing a hobby for 5 minutes. That's still looking after yourself. So definitely try and implement some of these. And as I've said, adjust as you can if these are activities you cannot do outdoors. And just finally, around goal setting. These are just some things to remember. Some of you may have heard of SMART goals before, but I just cannot emphasize enough how important it is for our goals to be SMART, because it does really enhance our motivation. So always be specific with our goals, know exactly what it is you want to do, make sure it's measurable, make sure you know how and when you've reached it, and is it achievable? Is it realistic and in our power to accomplish it? And realistic, of course, can we realistically achieve that specific goal? And be timely. When do we want to accomplish it? So always ensure, just like I've said in that diary we can create for ourselves, try and adhere to the SMART goals as well, because if our motivation is increased, we are kept busy, we are keeping our family and kids busy, and that in itself will actually improve our well-being quite a lot. And at a time like this, it's the little things that can make a difference. So even if we're improving our well-being by 10 or 20% and helping our family members out, that's still better than what it was. And at a time like this, that is really convenient as well. Okay. And just so you know what our socials are, please make a note of these. So our website, inspiritedminds.org.uk, and that's our email address if you do have any questions as well. Okay, so thank you for listening, and I'll pass it back for any questions.
That's brilliant. Jazakallah khair, Khadija, for that presentation. There is one question in the chat box from presumably a healthcare professional who's asking if there's any advice around their mental health, because they're obviously implementing strict isolation with vulnerable family members who are at home. They're doing their duty by going out to work to save people's lives, but they have a conflicting loyalty and feel as though there's a greater right over them by their family. Do you have any advice for those people?
So of course, I know some of us are in that situation where we do have to still go to work and things. It's a difficult one because obviously we still have to follow our work guidelines, don't we, ultimately? So it's hard to really answer that. But I guess really it's about talking and having open communication with people at work to see what they feel might be helpful for us and if there are any adjustments, because ultimately we don't want to be putting people at a very real risk. But I guess just coming back down to the main issue at hand, which is around our mood, and obviously as the question says, making us feel like they have more of a right over us than other people and we maybe shouldn't work. It's finding that balance, I think. Just always speak to your workplace about what your concerns are. And again, at home, just make sure you're taking those precautions as per the previous speaker has mentioned as well. And then just find that balance between those two things.
Brilliant. One final question. Is there a resource for mosques or imams for if they get asked about providing mental health support? Is there anywhere that they can go to find resource as to how to give guidance?
Yeah, so what I would suggest is definitely check out the website that we have. There's a lot of information on there and all the links to our information and webinars around the coronavirus. So definitely have a look at that. And for any other questions, you can always use our Q&A if you'd like, or of course, just get in touch with us and we'll try and support as best as we can as well.
Brilliant. Jazakallah khair, Khadija, for the presentation and the great work that Inspirited Minds is doing. If I can now ask Brother Ishaq from the National Huffadh Association to take the stage, unmute, and show your presentation, inshallah.
Okay, assalamu alaikum wa rahmatullahi wa barakatuh. Apologies for the sore throat. I'm just going to be speaking about very important topics of keeping our children occupied with fun Islamic activities. My name is Huffadh Association. I'm the founder and CEO of National Huffadh Association UK. I think in light of what's been happening in the last few weeks, I do want to make a point of one thing. In terms of these activities, there are many activities. I've just tried to condense and include the most relevant kind of for this PowerPoint, but inshallah I will share contact details for our organization, so if anyone does want to get in touch, inshallah you're more than welcome. Just a kind of brief background about who we are. So alhamdulillah, we have been established since 2016. We have currently over 3,000 Huffadh registered with us. We specialize in Taraweeh placements nationally and globally, with over 500 provided nationally in the UK and 150 globally around the world. We run over 20 WhatsApp support groups for Hifz support. So for example, we have a group for parents, for teachers. We also have a group for students, for people who are professionals, so working in a professional environment where there's not much time really to check or to read the Quran and try to promote that kind of connection with the Quran whilst maintaining a professional kind of hectic schedule at work. So our WhatsApp groups are catered for different people from different parts of the society and community. We've organized over 30 courses nationally for Hifz support, and alhamdulillah, we have delivered seminars in Norway, South Africa, Malaysia, and the USA. In terms of our work, we do obviously specialize in kind of providing support, not just for those who have memorized the Quran, but anyone who wants to memorize the Quran, and anyone who is aspiring to memorize, and anyone who has already memorized the Quran. So there's a wide range of support networks available. Now, in terms of fun Islamic activity and ideas, I do want to mention in terms of what types of activities there are out there. And I've just, obviously, as I mentioned at the beginning, there are many types of activities our children can be engaged with. But I think I just want to kind of go back to the first slide, and three kind of main words I want you to focus on is character building, quiz, and rewards. And I'll explain why those elements are important to home learning, and especially given the situation we're in now. So obviously I've included a few kind of pictures. So in terms of arts and crafts, there's many opportunities online, and I will share some resources shortly. Arts and crafts are a good way to kind of get kids involved in practical activities, etc. Character building as well, in terms of kind of promoting the characteristics of a Muslim or a Muslimah for our children. And I think at the moment, leadership development is something which is lacking in the youth. And this is something we are trying to work with the Muslim Council of Britain support. And inshallah, we look forward to hopefully launching something very soon in terms of character building as well. Quizzes and board games, I think competition, being a qualified school teacher myself, I think competition is very healthy, and if you promote that within Islamic activities, it can promote more fun learning as well. So kind of quizzes and character activity is very important. Board games, I mentioned a few here. So there's Quran challenge, there's also a Hadith challenge, there's five pillars. There's Medina Salah fun game, Hajj fun game, and the Great Mosque game. There's many board games, there's hundreds of board games activities, but I've just kind of highlighted a few crucial ones you can purchase off eBay or any kind of prominent Islamic store online. And again, these board games really kind of get the family together, builds that community spirit, unity, and increases that love for Islam. As well as that, rewards and stickers, for example, I have a daughter who's nearly going to turn 3 this year, and what we're doing at the moment is, for example, if she helps me in the house, so like yesterday I was kind of just doing some house cleaning, and I was hoovering, and she came to help me, mashallah, she started hoovering, and just for that, I said to her, okay, I'm going to give you a sticker. So straight away she got really excited. I gave her the sticker, and she now said to my wife, look, I got a sticker because I helped Dad ultimately. So maybe it might be if you pray your Fajr on time, or if you pray your Nafil Salah, or if you read Quran, you will get a sticker. And you know, these are very kind of customized. You can see from the screen, alhamdulillah, I'm very helpful, mashallah, I'm polite, you know, and these kind of instill mannerisms and akhlaq within our children, and it goes a long way. Even for Quran, if your child memorizes a surah, give them a sticker, give them a certificate, reward them. Rewards and incentives are what our children need the most, especially right now. You know, everyone is confused. Children do not really understand so much in terms of what's going on. Some do, but the vast majority are a little bit confused. So we need to kind of maintain that love of Islam within the family home, and kind of promoting that to, you know, on a wider scale. So providing rewards and sticker programs, as I mentioned, memorizing the Quran, learning the Hadith, doing chores around the house. It's not just for Islamic activities, but generally around the home as well. Storytelling and reminders. I've just included some of my favorite books that I use. So stories of the prophets are a very good way to teach our children more about Islam, and to kind of promote that, you know, love for Islam through storytelling. You know, the Quran, mashallah, contains many stories of prophets. And one of the key, you know, learning points where I feel our children would engage more is by storytelling and reminders as well. So again, this is a good way to interact with children as well. We've also got an app which we launched last year, alhamdulillah. It's called the Tahfidh Memorize app. This app is full of resources. We have a Hifz quiz, which is updated weekly, so you can take part in the Hifz quiz. There's loads of Hifz tips. There's a Hifz tracker and Hifz tester. These two features are only available on Android, but inshallah they will be developed for iOS very soon. You can listen to Quran, you can stop the Quran, restart, you can change the speed, the reciter. It's kind of tailored to those who are memorizing the Quran. There's Taraweeh training, and there's lots more resources. So please do check it out. It's tahfidh.memorize, and it's available on both the Android and iOS app and Play stores, respectively. So this is kind of a fun way to keep children interactive, especially the Hifz quiz feature is very, very popular amongst children as well. In terms of free teaching resources, so we've recently been working closely with An-Nasiha Publications, who are based in Leicester in the UK, and they have a free resources tool online. So annasiha.com/Teachers Forum. You can see the website at the bottom of the screen. They basically have a wide range of resources, so PowerPoint presentations, fun coloring worksheets, posters, booklets, certificates. Again, one of the core elements of their work is they try to make Islamic learning fun. So trying to promote more activities so children can be more hands-on, coloring, etc. I personally have taught the syllabus as well, and have done some training around it as well. So mashallah, it's very, very user-friendly. And again, even kind of from learning disabilities, students with special educational needs, it really promotes that as well, and the work really caters for that audience as well. And mashallah, they have a wide range of resources, so do check out the portal online. You may find something useful for your children as well. There's also the Maktab project, which is a very new project, mainly spearheaded through the COVID-19 crisis. So one task is uploaded every day on Instagram to keep the children the love and you know, kind of aspiration to learn the deen, and also to involve the family in mini projects. So do check them out on Instagram. Every day they are posting to keep kind of people engaged, especially the children. And mashallah, it's been a very huge success so far. And every day they share many kind of meaningful projects to keep the family kind of, you know, occupied. There's also Into Amal, who are based in the northern part of the UK, in Bolton, and mashallah, they've been established for many years, and they have kind of a wide range of character building exercises. So they have activity and coloring books. We have the flying carpet, the coloring book. You have the activity book, My Brother's Shield. You have also for adventures inside the home, for example. So practical, fun, and creative activities, again, trying to implement the love of Islam within our family homes, and most importantly, keeping our children occupied in a fun and interactive way, because our children will learn Islam in a way that is relevant to them. They will not necessarily listen to YouTube lectures or read books, but if you kind of promote these types of activities, it will make them want to learn about Islam in a bit more detail as well, inshallah. Our response to COVID-19. So we have, alhamdulillah, just launched a Madrasa online resource WhatsApp group. So you can join our WhatsApp groups if you just message our number, which is +44 07957 734 732. We have a wide range of resource groups which are admin posts only. So you won't get a high influx of messages being posted daily. We have control over who posts, and again, we promote a wide range of online resources, so do check that out as well. We have weekly online teaching webinars via Facebook Live. So last week we had a webinar called Madrasa Digital Guide. We will also have one, inshallah, every Wednesday starting from this week. This will be our second week in the coming week, where we'll be teaching how to use Zoom and Facebook Live for teaching online as well. We also have weekly Jum'ah reminders from scholars around the world. So we will be starting that again, inshallah, next week, Friday. And we are also working on a Taraweeh at Home toolkit, which will be launched in a few weeks. Many people have been asking about Taraweeh. We haven't made an official response, but we are working on something, and we will be liaising closely with the Muslim Council of Britain and hopefully with BIMA and other organizations to see if we can put something constructive together so people are more educated and kind of help the community to go through Ramadan with a toolkit for Taraweeh at home in light of obviously the mass gatherings ban, etc. In terms of contact, just to finish off, you can contact the UK Huffadh network by emailing at info@ukhuffadh.org. Our WhatsApp number is on there. And also we have a website, ukhuffadh.org. Our Instagram is at UK Huffadh, Twitter at UK Huffadh, and facebook.com/UK Huffadh. We also have a YouTube channel. If you just type in National Huffadh UK, it will come up on YouTube. So Jazakallah khair to the MCB, Muslim Council of Britain, for allowing me to present this work. And I look forward to working with you all. And again, any tips or advices you need for fun and interactive learning for your children, please do not hesitate to get in touch. Jazakallah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.
Jazakallah khair for that presentation and for the very impressive body of work that's already been undertaken, I think, before the coronavirus crisis and now also due to the crisis as well. We had one question in the chat box, which I'm not sure how applicable it is considering the current direction of travel with the crisis at the moment. But if things were to be relaxed, maybe not this Ramadan, but for next Ramadan, and someone would, other mosques would like to contact you to for Huffadh to lead Taraweeh, how would they go about doing that?
So yeah, Jazakallah khair, Asif. As I mentioned clearly in the PowerPoint, we don't want to kind of send out a press release as yet. We are, we are made aware of the situation daily. We are in communication regularly with medical professionals, scholars, etc. So you can get in touch with us via our email. At the moment, we have postponed Taraweeh placements in light of Muslim Council of Britain's guidance, and we're working closely with them. As I mentioned, I think at the moment we need to be ready for a possibility of possibly may not be Taraweeh offered in the masjid in light of what's been happening. But again, that can only be reviewed in the next few weeks closer to Ramadan. But we will be providing Huffadh, so people, for example, in local homes, if you don't have a reciter and you want someone to recite Quran, there will be, inshallah, opportunity available. And alhamdulillah, in the UK, we have far more Huffadh than mosques. So there are many Huffadhs that have reached out to us, and inshallah, we will be releasing a support initiative soon, inshallah.
Okay, fantastic. Jazakallah khair. If I could now move on to Brother Fadi Itani from the Muslim Charities Forum to give his presentation around volunteer initiatives and hardship funds.
Okay, Jazakumullah khair. Bismillah ar-Rahman ar-Rahim. Alhamdulillah wa salatu wa ala Rasulillah. We ask Allah subhanahu wa ta'ala to help us, give us the strength, all of us, inshallah, to overcome this test, and hopefully, inshallah, by the end of it, get closer to Him, inshallah, and serve our people and humanity at large, inshallah. Just a quick introduction. The Muslim Charities Forum is a network of Muslim INGOs, and recently we start working also with NGOs, which basically two parts. One is responding to international emergencies and development, and now our colleagues who are also responding to UK social action or needs, as we call it. It was established in basically over 12 years ago now, and we have most of the big charities, alhamdulillah, on board. The objective is basically create dialogue, encourage cooperation. We focus on research, advocacy, as well as capacity building within the sector. We came together recently to respond to this crisis as a part of the National Muslim Response, which is at the moment coordinated and chaired by the Muslim Council of Britain. And probably some of you know they are different working groups under this, and we lead on the charities and the Muslim response or the Muslim community response working group. Currently, we're doing what we call it a mapping exercise. Has been going on for now over 10 days to capture all the community and groups and charities who are responding to this crisis. So far, we managed to capture around 70 different, alhamdulillah, organizations and groups across the country who are responding locally. And most of our national and international charities also they're responding and doing, alhamdulillah, some amazing work. The key to all this response is going to be local. Local is going to be a challenge for all of us due to the restrictions of movement and, of course, what we call it, the protection of our staff and volunteers in general. We currently, we just on Friday, alhamdulillah, something we've been working on, which is the first ever national emergency appeal to be coordinated among Muslim charities and groups. And we basically we launched on Friday, which was more like a soft launch with the support of all the umbrella organizations from like a moral support. And we hope, inshallah, through this, if we raise resources, we're going to be working through local response organizations and charities across the country. And we currently identifying them. And this part of also the mapping exercise which we're conducting. And the idea is to support individuals and families who are going through hardship, as well as organizations who are basically in need of a bit of helping hand with some resources. Alhamdulillah, the appeal is I'll probably share. Can I share, Asif, I can't share at the moment. One second, inshallah. Bismillah. Bismillah. This is basically the appeal, which is under the title COVID-19 Campaign for National Solidarity. And the idea here is not just about raising money, it's about really going beyond charity for all of us. And there is a lot of volunteering, alhamdulillah, happening at the moment on the ground. There is a lot of local groups responding. So we thought in the top of just raising funds, let's also make sure that we together understand what's happening all over the country and connect locally volunteers with what we call it groups. And inshallah, in the next couple of days, an app will be available. The colleagues are at the moment working on it quite fast to basically you can see whoever responding across the country to local needs, and then people locally can connect with them to support, to volunteer, and so on. We have issued a couple of guidelines, one to charities on how to protect their business model, as if it's right to say this word, in a way that Ramadan fits in the heart of this, what we call it, crisis. And Ramadan for many of our charities, as well as mosques, and of course our Ummah is an important part of the Islamic calendar. And a lot of those charities are most now challenged due to they may face lack of resources. So we're hoping, inshallah, that together we can overcome this issue. The second part of our second guide was about how to respond locally and support local organizations by taking into account the different measures of what we call it local cooperation and protection, inshallah, for whoever getting involved, and hopefully avoiding any duplication. we hopefully, inshallah, Monday, which is tomorrow, inshallah, if Allah subhanahu wa ta'ala will, is we're going to publish the third guide, which is for volunteers and volunteering on taking into account different practical advice and issues. And let me just share another, Bismillah. This is just for information. This is an icon, inshallah, we developed, which will be pushed from hopefully, inshallah, tomorrow, that we all can basically utilize. The whole idea, my dear brothers and sisters, is this initiative is not just another charity or fundraising initiative, and this is not something we had in mind. It's basically an initiative to bring our charities and organizations together, as well as try to, what we call it, spread hope, inshallah, and give some support to our communities, as well as really stay together and work together. And this is the time that we all need to do so, inshallah.
Fantastic. Jazakallah khair, Brother Fadi, for the great amount of work that's already gone in that we can see very clearly, and for the presentation today. We don't have a number of questions there for you at the moment, simply because I think your presentation was so clear. So, alhamdulillah, I think we have things coming out. So, inshallah, as and when they come out, we will push them out.
No problem.
As well.
My final comment, inshallah, I'm trying to share something, but my phone is gone on freeze. Is basically one is the national campaign is on launch good. So if you basically, our brothers and sisters across the country, they would like to know what's happening and see it. It is on launch good under the campaign for national solidarity. And if they require more information, which is the website of the www.muslimcharitiesforum.org.uk, inshallah. May Allah bless you all, inshallah, protect all of us, inshallah, and give us the strength to overcome this test, inshallah.
Ameen, ameen, jazakallah khair. We'll share those details as well with the attendees, inshallah ta'ala. Okay, we had a few questions that we couldn't get to earlier on, but I think now we have a few minutes. They are quite important questions, mainly around issues to do with burial. We have Dr. Wajid on the line as well, who I know has been working very hard in this area. Dr. Wajid, if you can give it just a quick update as to where we are with guidance around the burial situation. There are also a couple of very questions around how effective bodies are after they passed away.
Assalamu alaikum, jazakallah khairan, alhamdulillah wa alamin wa salatu wassalamu ala anbiya mursalin nabiyina Muhammad wa ala alihi wa sahbihi wa sallam wa alayhi tasliman jami'an kathira. So I want to point out two things. The burial side of things is being dealt with by the National Burial Council, and I think they will be updating their guidelines and sending it out. They have a set of guidelines out there. But we have a situation right now, and the Muslim community is confused, and they have every right to be confused, where you have well-known, reputable scholars saying that absolutely you must not do ghusl. There is these people who die in a plague died as shaheed, and therefore they should be buried as a shaheed, and there should be no ghusl, they should be buried as is. Then you have other well-known, reputable scholars telling us that you must do ghusl, and that the obligation is not lifted. Now, I'm not a mufti or a scholar or a sheikh, and it's not for me to say on the fiqh opinion, but this situation is simply unacceptable for the Muslim community in general, because we are trapped between these opinions. And this is, I'm afraid we keep finding ourselves in this situation where we get trapped between these opinions who are diametrically sound opposed, and the community, it adds to stress and confusion in a time that we really don't need any more of this. So if I sound annoyed, it's because it is an annoying situation to be in. So as the area we can talk about is the medical side. And the medical side, is to say that there is also confusion on the medical side. There's some medical bodies, Public Health England, World Health Organization, that say it's fine, go ahead. And there's some bodies that are outside the UK, from whether it's Italy, whether it's Singapore, whether it's Malaysia, whether it's the Islamic Circle North America, who are they're saying the opposite. So again, in the medical side, you have the same issue. You've got this confusion, and again, the public is confused, and it's highly annoying. And what I'm trying to get at here, brothers and sisters, is that actually what we don't want is a yes or no answer. What we need as a community is to say that what are the steps needed to make sure that if you do ghusl, do you need these steps in place? If you don't do ghusl, you need these steps in place. Can the body transmit infection? It's a low risk. An infection is transmitted through aerosol spray. The risk of transmitting the infection is low from a deceased body, but low risk is not the same as no risk. Low is relative. If the risk of transmission of infection is 50%, for example, with a living person, it might be 5% with a deceased person. It's still there. The infection can live on inert surfaces like cardboard for 24 hours. So it stands to reason that it can also live, if it's been aerosolized onto a body, it can live there for a length of time. It also lives on fomites, which are areas which they particularly like, for longer. And hair and nails are particularly places that they can live on for longer. It's also transmitted by feces. And this is an area that's closed, that's washed in ghusl. So again, it can be transmitted that way. So as the British Islamic Medical Association, our job is just to tell the community that our job is not to tell which way to go. This is for the scholars to determine, and each scholar for different communities will determine that. Our job is just to take the advice that's out there and to make it relevant to the Muslim community, and that is to say, there is risk from the dead body, but it's lower than from a non-dead body. Number two, there are certain things that you do when you do ghusl, if you will go do ghusl, that will make it high risk, like using a spray on the body. This will make a low risk procedure into a high risk procedure, or the back passage area is a high risk area as well. Number three, it's about putting on and taking off the personal protective equipment, how you making sure you have the right amount and that you wear in the correct way and that you remove it. So for example, there were some people who were saying that we're going to wash ours and reuse it, which doesn't make sense because it's a single-use equipment. So our advice right now, we're going to come out with some graphics for the Muslim community, but our advice right now is that whichever way you follow, the ghusl way, which is of course the opinion that all scholars agree is that's the preferred method, if possible, or the non-ghusl way, make sure that you consider that what are the practical and medical steps that you need to take to stay safe in either scenario. That's our advice right now.
Okay, Jazakallah khair, Dr. Wajid. I know it's a very fraught area, and I think you're handling it very well. Explained that very clearly indeed. So just to be absolutely clear, you're saying there is going to be something coming out from the National Burial Council, hopefully soon, in terms of a revision of guidance. So I know there are people in the chat box at the moment saying that we need guidance. So just to clarify once again, there is already guidance out there from the National Burial Council, but that will be revised and updated and sent out again soon, inshallah.
Yes, and there will be separate advice from BIMA, from the British Islamic Medical Association, about the medical aspects about this. A lot of people need to understand something. The advice, unfortunately, and I don't say this often, unfortunately, a lot of the advice that you get from the authorities, you have to take it with a pinch of salt right now, because no one can be an authority on a disease that they didn't see coming 2 months ago and that is evolving rapidly. You can see that people are making U-turns all the time. So they're sending, they're sending staff to the front line without the correct equipment. Sometimes it's not because it's safe go and see patients without a visor or without a proper respirator. It's because they don't have it. So what are they going to say? Leave the patients to die in the hospital? So similarly, what we're doing is we're providing the advice to say, this is the advice specific to our community, specific to ghusl, specific to where the ghusl normally takes place. And the BIMA will be publishing that hopefully in the within the 24 hours, inshallah.
Brilliant. Jazakumullah khair. Now can I ask Brother Haroon to close the session for us, inshallah, summarize and let us know the next steps, inshallah.
Thanks, Asif. Assalamu alaikum to everyone again. Alhamdulillah, you've heard today from various people around different issues which are facing us since coronavirus hit the UK. We heard about mental health and how we can address it, and all of this information will be shared with you after the meeting. It will be emailed out and sent out. The links will be sent out, and a recording of the meeting will be available as well for those who want to benefit from what's been shared and said today. Just a couple of things. I think there's a image up on the screen for those of you who are able to view it. Just from the Muslim Council of Britain's perspective, as some of you may know, as the largest umbrella body representing Muslim organizations and mosques within the UK, we've been very much involved in the provision of information and organizing our communities and working with our partner organizations as from some of the ones that you've heard from today, in trying to bring a collective view to help our communities to really face this challenge, this immense unprecedented challenge that we face in society today. So we've been helping initially, as I said before, helping a lot of masajid up and down the country, providing guidance and support, holding these regular weekly briefings for hundreds of people to provide as best as possible within our ability the most up-to-date and correct information that we could pull together from not only from a health perspective but also from an Islamic perspective as well. And we're working, these meetings don't just happen. There's a lot of work, a lot of people give time. My colleagues around me within MCB, everyone is volunteering and they're working 24/7, as well as our own staff. We have a handful of staff who pull these things together as well, and then providing regular updates to you throughout the week. So I would give a gentle reminder to everyone, for those of you who haven't, we're not, MCB as an organization is not funded by government or anyone else. It's a voluntary organization, just like all the other charities. So please, if you have a spare moment, have a look at our website. There's a link at the bottom of the slide, which you can't click on, mcb.org.uk/friends. If you go to that link, you can just join. If you're not able to contribute, you can sign up and receive updates from us. And if you're able to help us, alhamdulillah, please do make a donation, a standing order, something to help us, to help you to get the right kind of information and to keep our communities safe. Coming up in the next few weeks, as we mentioned before and we've heard alluded to in the discussion, we have challenges in terms of deaths and burials coming, but also Ramadan and Eid al-Fitr. And I think over the next week or two, we'll try and address some of the concerns around this and how, as a community, in this very unprecedented time, we're likely facing a Ramadan in my lifetime and in the UK that we may not be able to go to the mosque for Taraweeh, possibly. We don't know. I mean, Ramadan is just 3 weeks away, and we're yet to hit the peak of this virus and the impact of it. So, you need to watch the space, watch the news, listen to the briefings. I know there's a letter that's come out today, posted from Downing Street to every household in the UK. So, that's, again, this is, in our time, this is unheard of for the Prime Minister to write to every single household in the UK. informing them of the situation that we're in. If we haven't really woken up to the seriousness of what we're facing, there's no time to delay. And I would just again re-emphasize that we need to stay at home where we can, only for the very essential things, to go out if needed, and keep in touch with our family members by phone. Phone up the relatives that we haven't been able to speak to or seen. It's a different opportunity for us, and also for our own self-development and spirituality, to remain close and reflect on the Quran and Salah, and keep close with our families, inshallah. So I'll hand back to Asif. Jazakumullah khair. Assalamu alaikum.
Assalamu alaikum. Jazakallah khair, Harun, for your leadership and for everything that you've done for the community so far as well. And Jazakumullah khair to everyone who's attended. Just your attendance shows your concern for the community and for yourselves and for the Ummah and for this whole world, which I think we should all appreciate. Just to echo Harun's words, please do stay safe, stay in your houses, please do not go outside unless it's absolutely necessary. Do follow the guidelines and guidance which has come out from government in terms of staying safe as well, and staying at home, as well as guidance which is going to come out and has already come out from our own organizations like BIMA and the MCB as well. So I'd like to close the meeting here. There will be another one of these briefings next week. There'll be more information about that during the course of next week when we'll be sending out another link to that briefing call, inshallah. Jazakumullah khair again to all of our speakers who've given their time and their efforts to this cause as well. Okay, Assalamu alaikum wa rahmatullahi wa barakatuh.